Wonderful. So I'm just going to introduce real quick. First of all, I'm Taryn Brady with the NYACCE board and on the conference committee. And today and this afternoon, we are going to talk to a representative of the door, actually the managing director of the Career and Wellness, and that is Richard Riggins. So I'm going to hand this over to you, and you're going to tell us about the economic impact on BIPOC youth in education, healthcare, and employment.
Absolutely. And thank you so much for this opportunity to not only represent this work, but also represent the wonderful work that my staff is doing. One of my staff members that I can see right now has been through this lost period with us for the entire time and seen a lot of the things that I'm seeing. So I welcome this opportunity to talk about the representation of this work and how it's impacted not only our young people, but also how the staff have responded and how we've responded as an organization. So I call it the lost year simply because it had an economic impact on BIPOC young people in the areas of education, healthcare, and employment. And those are not the only indicators that should be considered, but those are the primary, to me, the primary indicators that should be considered coming from my viewpoint and vantage point of career and wellness. But of course, there are other conversations to be had, but this is the one that I want to have today. I think that for us, the discussion around and regarding the impact of BIPOC communities adversely affected by COVID pandemic is often seen from a deficit-based perspective. It's not really seen from a place of success or seen from a place of how to help support those folks that are impacted largely by or were impacted largely by the pandemic and will continue to be impacted. And often this perspective perpetuates the notion of victimology of a culture of people rather than having ownership in debunking and sort of avoiding a blaming narrative. And so what I want to do instead is to use my presentation today to state observations and learnings that we've had in the field and ground my delivery in tested approaches as an organization based on logic and person-centered approach to this work. This conversation will hopefully open up three valued viewpoints. And like I said before, this isn't the only narrative, but this is just one of the narratives. Three valued viewpoints regarding the narrative around intervention and supports needed for BIPOC communities to counter the dominant power systems that work to heal or fix inequities, because I don't think that there's necessarily this sort of savior thing that needs to happen. It's more bringing to the table different conversations, different participants, different viewpoints, and having conversations about how to really have incorporative work happen, to really have thoughtful approaches to generating not just conversations, but generating real change, real systemic and valued change for BIPOC young people. So the pandemic placed a spotlight on systemic racism in the United States, revealing inequities in healthcare and employment and education. And that was really amplified within the BIPOC community. So BIPOC youth have faced different sorts of segments of this work. And one of the ones that I want to talk about right now is education. So sorry, I'm going to put this down to maybe there we go. All right, there we go. So BIPOC young people have long faced systemic educational inequalities that have been exacerbated during the pandemic. One of the things I noticed in my research is that the U.S. Department of Education indicated in a study for 2021 that BIPOC young people were twice as likely to be learning remotely, still continued and ongoing, as opposed to their non-POC counterparts that have been able to integrate back into the environment for education. There are many reasons, multitude of reasons for this. I will probably get to those in a bit, but I just wanted to point out that this is a very important point, because the issue that it brings is that remote learning places the burden of teaching and learning on BIPOC young people and their caregivers, making it increasingly hard to access academic content during the pandemic. And that was one of the things that we found as an organization. BIPOC young people were less likely than non-POC young people to have a parent or caregiver who could work from home during the pandemic. And so because their parents had to go out to work and potentially be impacted by COVID in a more first person and less safe way, the issue that it brought up is that it meant that they had to manage their own schedule and learning to a greater extent than their affluent peers, as their parents were seen as essential workers. Young people also found that they were the caretakers of family members directly impacted by COVID or childcare support for families without access to school resources. BIPOC young people were already experiencing an education gap in comparison to their non-POC peers. The shift from distance learning formats, the fewer family resources, which sometimes had to be shared from siblings and parents and caregivers needing to work from home when they were able to work from home, devices that were either older, if present in the home, and not technology compatible with the current framework of what we're using now or what we've had to convert to as school systems. Sometimes there was lack of access to camera, microphone, headset, internet speed, broadband, to remain competitive and on par with their peers in the systems. And at home with a parent or caregiver themselves that did not understand how to support or assist with learning, we found that our young people were, by and large, put at an immediate and determinative deficit. And so the lack of access to workbooks and reading materials, along with the inability at times to load the classes onto computers and thereby missing out on days of work, put them back in a way that it should be framed that this was not only a counter to the culture of learning, but also an impacted and increasingly concerning place that teachers found themselves also at a loss for. According to some economists and recent studies, BIPOC young people re-entering the job market were less likely to get access to opportunities. One thing that they pointed out in I think it was a September or August marketplace podcast was that associate's degree holders that were from BIPOC communities were less likely than their non-POC peers to get access to job opportunities based on this, and less access to job opportunities based on their education attainment that they had as an associate than people that were dropouts. And so some of this is not just around the environment of COVID and not around the environment of the pandemic, but specifically around the environment of discrimination within the context of that. BIPOC young people had less access to technology and supportive resources than their peers. And the issue that this brings up is that due to historical patterns of discrimination and community redlining and housing instability and differential access to technology infrastructure, many BIPOC young people that live in homes without computers or devices, internet, or dedicated learning spaces were severely impacted by their lack of access to technology, so much more so than their non-POC counterparts and peers. All of these items are essential to creating an effective online learning and teaching environment, and they did not have that. And that presents an unfairness that will put them behind, quite honestly, for years to come. BIPOC youth tend to have underfunded and under-resourced schools, districts, which they now found themselves without teachers. Teachers that were in the classrooms were sometimes substitute teachers for, I think, what the report said, the Pew report that I read said it was about 80% coverage from substitute teachers. And this is not to disparage substitute teachers, because they did show up and they did provide some online teaching and they did provide some layer of support resources. But when you think in terms of people that were already in a deficit situation being taught by someone who might not have the same level of pedagogy or same level of understanding or awareness about what they would need within the classroom environment because of the transient nature of their teaching style, then that was problematic, because you'd have a teacher that would be expected to teach math one day and science the next and English the following, when their specialization might have been in just one key area. And that is problematic for young people that were BIPOC in learning communities and environments where they were underfunded and there was a shortage. So when thinking about healthcare, you have to, and the reason that I reframed this entire thing to be not just about education and employment, but also about healthcare, is because you can't think in terms of the pandemic without thinking about the impact of healthcare on the environment of learning for young people. BIPOC young people have had significant inequality when it comes to lack of access to sustainable healthcare, which further was pronounced during the pandemic. In 2013, the National Institute of Mental Health estimated that nearly 50% of all young people aged 13 to 19 had ever had a mental health condition, and around 28% meeting the criteria of severe impairment. That sort of pronouncement doesn't come without us understanding that 3.5 million young people in America were seeking mental health services that didn't have access to mental health services or to counseling outside of the education system during 2019, prior to going into COVID. When they were asked to go home and required to go home and be in those environments that sometimes they were talking about in these counseling sessions and sometimes addressing with their counselor at school, they were left without the resource of how to really handle and manage some of those things, which cropped up and impacted and really presented a lot of range of mental health issues that are still impacting them today as they're trying to re-engage and reconnect with what's going on within the world of school and the world of work and just the world itself. Poor mental health is associated with a range of health development concerns for young people, including but not limited to substance abuse, violence, partner violence, suicidal ideation. Poor mental health is associated with lower educational achievement, and itself is a predicator for long-term health outcomes that need to be considered. And so when we talk about the impact of young people, that 3.5 million young people that in 2019 were accessing school services, we have to sort of dive down into what that truly, truly means. When we look at that, we're not just talking about 3.5 young people accessing their school counselor or accessing in-school aid. We're talking about 3.5 million young people that potentially didn't access this service prior to that because they didn't have access to the right amount of healthcare. They didn't have access to the comfort level that they needed in order to think about how to access healthcare and mental health services. And that ripple impact commingled with all of the things that they probably face at home: depression, suicidal ideation, substance abuse, partner violence, domestic violence, underage drinking. Those things have a pronounced effect and impact on their access to education, because if those things are happening along with them not having access to technology resources, along with them not having access to the services that they need in order to address some of their barriers, this comes with a cost to young people, especially BIPOC young people. And BIPOC young people who experience mental health difficulties at school tend to exhibit poor school adjustment, reduced concentration, lower achievement, problematic social relationships, and a higher rate of healthy risk behaviors. So it's important to note that it's not just talking about one thing in isolation. All of these things have a ripple impact on young people. BIPOC young people are less likely to have employer-sponsored health insurance based on their ability to qualify for employment in sectors which contribute to long-term healthcare options. And so because of this, that 3.5 million that were receiving services within their school systems now find themselves at a loss to even remotely have access to some layer of support, because their parents also might not have access to employer-sponsored health insurance just based on where they might have worked and whether or not that place offered health insurance. And so we need to consider the larger ramifications of these things. BIPOC young people are less likely to have access to sick or personal leave of their jobs, and they're more likely to work in proximity to other people, which increase their risk when they were able to work during COVID at all. So think of the mask issue. Just for a moment, think of the mask issue and how people reacted or are reacting or have historically sort of thought about vaccinations and masks. This is not to disparage anyone at all or not to cast any sort of highlight either way, but to just point out an observation that young people who had no choice but needed to earn an income were then put into positions where they had to choose between earning a livable wage and having access to some level of resources so that they could pay for basic bare minimum healthcare and not. And that's a hard place to put a young person who's under the age of 24 whenever you're talking about decision making, because their incomes did have an impact on their families, and their incomes continue to, because of the condition of their environments, continue to have an impact on how it is that they operate and move about the world. BIPOC young people are less likely to be able to work from home, which indicates an ongoing condition of their impact of stressors and economic disadvantage. Because they don't have technology resources, or because the technology resource jobs are not set up to support them in working, there is more of a likelihood of them to not be able to connect to or contribute to that employment sector, which further puts them at health risk. Lack of access to broadband technology and technology resources had an impact on BIPOC communities, which were hardest hit by the epidemic. Their communities were saturated with all of the infections and all of the lack of access to medical services, the long lines to wait for testing, the long lines to get services for medical attention. What it also represents, this lack of access to the technology resource for us, is that the other layer of that is that young people then, when vaccinations did come out, if everyone can reflect on this, when it did come out, the vaccination came out online. You could sign up online, you could set up your time to go and get your vaccine online, you could make sure that you had your follow-up time with your doctor to make sure that it was done online, but guess what they couldn't get online? They had no access to technology or broadband resources, and that is a problem. And it's one of the critical problems around health and education and employment. BIPOC young people experience a crisis level rates of poverty and food insecurity, which contribute to healthcare disparities in comparison to non-POCs. Dating back to even colonial times, we're going to take it down to history, y'all. Dating back to even colonial times, BIPOC young people and their families have been excluded from systems which would have provided financial security, upward mobility, and generational wealth. As a result, BIPOC communities have been the hardest hit, and the economic crisis have created more joblessness, higher rates of infection and mortality, and a threat impending eviction looming over whether or not the housing moratoriums would continue. and hunger. And so all of these things commingled created this sort of healthcare disparity, because the stress that it creates for not only families, but for the young people within those families does have its own rate of how it is that someone would respond to not just what it is that they would think on and reflect on, but how it is that they would contribute as a person within the household. According to the Economic Policy Institute, that while non-POC average households experience a loss of 2.7% from 77,000, and this is important, from 77,000 down to 74,000 in earnable wage, Black households specifically remain unchanged at 46,000. Now, I think you think, oh, well, that's not so bad because they remain unchanged. But when you consider the contextualization that the average poverty guideline for a household family of 4 is baselined at 26,000, and the cost of a living person for a single person in New York City is somewhere between 40 to 42,000, then that also creates this sort of bubble that happens around healthcare disparities, and a reason to consider the pandemic even more of a systemic issue that we need to address as a community of understanding. And that's what I want to hopefully create with this conversation. The last month, the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry and the Children's Hospital declared that pandemic-related decline in child and adolescent mental health has become a national emergency. On top of the social isolation and the family instability, and medical groups that said that more than 140,000 young people in the United States lost a primary or secondary caregiver, with youth of color disproportionately impacted. So now we're not just talking about loss of a loved one, we're talking about the fact that that young person now potentially will be considered to have to contribute to the household, a household that was already behind its peers within the earning potential that it had. The American Rescue Plan and the Elementary School Secondary School Emergency Relief Fund, combined with other 2020 pandemic relief funds for schools, amount to more than $190 billion in education and healthcare grants over the next 4 years, and some of which will be spent on mental health. So that is money that potentially is out there, and how desperate the government is to address this, but how desperate the length of services are for the BIPOC community or communities of color. 37% of the survey's 7,700 respondents said that they had experienced some poor mental health during the pandemic, and 31% said that they had experienced poor mental health in the 30 days before their questionnaire. And this was for the American Academy of Pediatrics. 44% of students said that they had experienced persistent feelings of sadness or hopelessness within the previous year, and 20% had considered attempting suicide. And 9% of respondents said that they had attempted suicide. 28% of survey respondents who reported that they felt close to people at school prior to reported poor mental health, compared with 45% who did not report close relationships. And that comes back to the 3.5% that I was talking about that did seek out, that did identify for themselves, self-identify for themselves that there was an issue and that they needed help, and that they sought help within their school systems. So when we talk about education, when we talk about how it is that the education system contributes to the environment, and how healthcare is directly linked to the education system, that's what we're talking about. Students who reported feeling connected to others virtually were less likely to report poor mental health. 36% of respondents, compared to 42% of their peers, responded that way. So I just want to pause here for insights and open up the information so that anybody who would like to ask a question can ask a question at this moment, and I can also take a sip of my, my sweet tea, pause for parch.
I really like that you're sharing hard data. I mean, clearly this has been researched. We've seen it, we know it's happening, we see it, but it's also good to have some sort of numbers as well, because as you said, there are some things out there, there are some things that the government's trying to do to assist, but they might not get to everyone, and we need to get to everyone for inclusion in all these things, digital, healthcare, everything.
Absolutely. And I think part of why I did do a deep dive is because I kept being horrified by what I was finding. I was like, wait, what? Oh my God, what? So every time I clutch the pearls, I'm like, oh, there's something worse out there than what I even thought before. And when you consider and contextualize how impacted young people are disproportionately within communities of color and communities of need and BIPOC communities, however you want to call it, in comparison to their peers who already had resources, already had learning pods that they were learning in, and we'll get into that in a minute, but already had all of these different things that were sort of set apart and made for their environment, then that's concerning, because essentially it's like saying a young person is left on their own to their own devices to survive as best they can. And I personally, and I know almost everybody on this call, I have a problem with that. I have a problem with that. So yeah. So shall we continue on this like little track of information? Awesome. Let me go here. Okay. So when we talk about employment, we're talking about a different thing. And this is the wheelhouse. This is where we grease the wheels here a little. So BIPOC young people were significantly impacted by extraordinary unemployment rates stemming from lack of access to industry jobs based and usually available to them, based in telework, based in jobs that were available during the pandemic. So people got to work remotely, but not a lot of young people at all. And so that is huge. It is huge, because then you're taking away safety, you're taking away opportunity and access. So widespread job loss due to business closures impacted BIPOC young people from disadvantaged communities. The loss of employment at this critical point in their life for BIPOC young people during a pandemic can be stressful, isolating, and have long-term economic effects. The effects of a long-term economic impact are directly correlated with such things as social exclusion, the inability to gain work experience, the need to legitimize the work history. Those things, like, you need to have a work history in order to say that you have a work history. And if there is no work history because there's no access to work, then that's a problem. And most importantly, a direct pipeline to poverty and its related integers like housing instability and food insecurity. Employment provides youth essential opportunities, such as job skills and expanding their network. This from the Schultz Family Foundation was a very impacting and thoughtful comment that I really, really liked, because it's as though they understand and get it. So if you're drinking Starbucks, you're doing a good job, because the Schultz Family Foundation is based out of Starbucks. So good job. But also I think Tyra Mariani really sort of gets at the understanding about what risk values are around unemployment and how it exacerbates the economic divide between BIPOC young people and non-POC young people for like years to come. So when we talk about youth employment, it's more than tripled between February and April, jumping from 7.8% to 27.4%, exceeding the rate at the peak of the Great Recession. And the Great Recession, I know you're thinking, oh, the 1920s. No, we're talking about 2010, which was at 19.5%. You remember when the housing market sort of imploded around that time. So the 19.5% that you would see in April of 2010, 10 years later being 27.4%, that's huge. That is incredibly huge. And unemployment increases were more pronounced for young people for their age than people that were aged 25 to 54, whose unemployment peaked at 12.8% in April of 2020. This was attributed to young people's concentration in retail and hospitality jobs that were affected by mandates to contain the virus by closing, and the lack of telework options in the sectors where young people were primarily employed. In the second quarter of 2020, job losses in retail represented 16.8%, and in hospitality, 45.8%, among the highest across all industries for young people. Beginning of May and continuing throughout 2020, the economy recovered partially in some businesses and they reopened. But one thing that we found as the vaccination became more available, and this is something that we'll get into a little bit later, but as the vaccination became more prevalent and available, or as interventions became more prevalent and available, guess what also became more prevalent and available? The absolute disinvestment from businesses to hire BIPOC young people or BIPOC people back for jobs or to contribute to BIPOC communities. And that is something that we need to possibly unpack and look at, because at this point, we're talking about discrimination on a different level, but we're also talking about the fact that young people who might have been in a job before were now passed over for opportunities and employment. During this time, unemployment declined, particularly among white male youth, but among Black male youth and Asian male and female youth and Hispanic and female youth, unemployment remained around 20% until September. After the summer, the recovery slowed as some businesses permanently closed, and that had an impact, not just on communities where those businesses were housed, but on the people who worked in those businesses. In March 2021, 12 months after the outbreak, young people in youth employment was at 11%, 3% points higher than it was before the pandemic, and remained higher among Black and Hispanic youth. So there was something I was listening to again today, just so that I can make sure that I'm presenting this information correctly. And if I am hearing what I heard this morning, 3.5% was the amount for non-POC young people as far as unemployment in 2021. 9.5% was the number for Black unemployment for young people. So that is something that is a huge disparity and a huge disconnect with regard to how it is that young people were thought of and regarded and brought back into the workplace. Business closures in industries were hardest hit due to a decline in consumer demand, and a lack of remote work options led to a sharp increase in unemployment. Retailers closed their stores due to lack of foot traffic and portability of systems. And so they found ways to do this through telework. And guess, remember what we said about telework. Telework doesn't work for everyone. And so retailers with an uptick in online sales converted to that option, which significantly reduced the need for a higher number of employees in the longer term, a position that was previously occupied by young people of color. Youth unemployment was particularly concentrated in areas where states introduced stricter containment measures in response to COVID-19 infections. And during the economic downturn and recession, BIPOC young people tend to shoulder the brunt of unemployment in a different way than their non-POC counterparts. For example, 30.7% of Black youth and 22.6% of Hispanic youth were unemployed in comparison to 17% of non-POC youth. Even if the BIPOC young people within those communities were able to return, our findings at the door were that largely we heard that there was furloughs and that furloughed employees would receive preferential treatment, and that sometimes would be based on age and the need, quote unquote, for the young person to earn a living, or for the person that they were actually furloughing to earn a full-time wage. And so they were returning to potentially businesses that didn't want them simply because they were not either able to take on full-time work, or that they had full-time workers that needed the jobs more than they considered that the BIPOC young people needed the jobs. Not with the understanding or caveat that we pointed out earlier in this conversation, that BIPOC young people were now losing caregivers and seen to be needed to provide to this, this situation or environment where their head of household also needs their income coming in to help support and supplement missing income within the household. Compounded with that was the fact that finding a job is also lengthier, and returning to a previous employer also contribute to a slow roll in employment and back to normalizing in a way that was not necessarily readily available to young people. So let's pause for insight there and open up the conversation, because I just threw a lot of stuff at you, and I just want to acknowledge that. I also want to take a sip of my tea. Anybody? Because we can continue, and I want to make sure that I get all of this stuff in.
I remember when we were sent home in March 2020 and told that everyone had to stay home. It would be for 2 weeks and everyone would be back. But 2 weeks later, the team I worked with was back in the office. We were allowed to come back in as long as we wore masks and stayed separate. And we started working on distance learning and driving the students' homes and delivering packets and trying to do all that. And at the time, I was so jealous of people who got to stay home. Like, I thought, oh, everyone's got a laptop. And the more we delivered packets and found out that people don't have laptops, they don't have working smartphones, they don't even know how to access information that might tell them from the CDC what is going on. Some people don't even have television, they don't watch the news. So it was so frustrating to be like, man, I guess we're this link that has to bring this information to all the people we work with, all our underrepresented minorities and all our low income adult education students. So it is nice to see that, again, this is more of a conversation now, and the government hopefully is getting more involved, and hopefully we'll have a better system flow in the future, that mental health will be prioritized, that we can get everybody's soft skills and a link to what's going on for everybody in this country. But basically, I wanted to say, I'm so grateful now in hindsight that I had a job. I was able to keep my job and feel worthwhile. And I definitely had students who were stuck at home, and they were adults, and they felt bad that they couldn't work, that they had to take care of somebody. And it's so hard because mental health at that point was not a huge priority. There weren't enough services out there. So it was so frustrating to not be able to help them enough, just to be there to kind of like listen, but we could not do much more. Absolutely. I just wanted to share my feelings.
Thank you so much for sharing that.
Yeah, if I can, I would like to second that, Sharon. I will never forget. We were in like a team meeting. I believe it was March 13th, right? And literally in the middle of the meeting, it was like, everybody get your stuff. Like, we're done, you know, we have to go home. I think the biggest impact, speaking for myself being here at the door, was that, you know, we are a face-to-face based service. And young people know that they can always drop by and they can come in and see us. So it was very hard for me and for them, because everyone wanted to, like, I want to see you guys. But the good thing I can say, the fortunate thing about working at the door and us being the organization that we are, is that we were able to get technology out fairly quickly, and we were able to connect with our young people for the most part, but we were just all missing being in the physical space. And then when we were able to return, we slowly started trickling back in. And now we're getting back to the point where we're kind of at full capacity, and it's a beautiful thing to see like these halls filled. So I definitely second what you're saying.
Absolutely, absolutely. And thank you guys for those insights and for those points of discussion, because that is kind of what we need around when we talk about how it is that we are going to advocate for change. That's the next part. So I've told you all the horrible things. We get it, right? I know you're like, all right, we lived through this. We got it, Richard. Now let's talk about some of the interventions that we could possibly have as a community of understanding. And that's what I want the world to come to be, a community of understanding, not New York, Washington, DC, California. I want us to be a community of understanding, awareness, learning, and movement. And so in order to do that, we need to have some common working practices. And so I've outlined a few of those. I know you're excited. Ideas for opportunities and options. So I know, I love my graphics here, right? So what is needed to counter all of these? Everybody raise your hands. All right. Oh, there we go. So what is needed to counter all of these issues that contribute to further setbacks to BIPOC young people? So all of this stuff is framed in need of our agencies to be forthright in advocacy within government organizations, and to really hold accountable, not only when you go to the voting booth, but also just as you're talking to representatives, to really have a understanding of what their understanding is and have an understanding of where it is that you want them to level their expectations based on the need within communities of understanding. And so challenging communities to not think from a lens of scarcity, but rather to think about how we can collaboratively work on upholding and creating stronger and longer terms of impact environments. Sorry. Okay. Let's see. Okay. So, did it? Okay. All right. So let me reduce this down. Okay. So improve options for remote learning for BIPOC young people. Remember, at the beginning of this, I said, hey, we need to think differently about how it is that we're approaching education. That provided also with the understanding that some young people may want to return to in-person services. Some young people may not be able to return to in-person services. We need to have systems of operations for both. And one of those things is understanding that remote learning still might need to happen within BIPOC young people communities. What that looks like, ensuring that every young person has access to broadband, has access to devices, has access to technical support, and access to remote learning if needed, and unable to attend traditional schools persistently. So they might be able to attend school on Monday and Wednesday, but not Tuesday and Thursday and Friday, and they still need that information on Tuesday, Thursday, and Friday. And so offering opportunities for them to have different engagement levels for learning will be critical and important. Engage parents and caregivers through ongoing and well-timed communication that allows for families to communicate what it is that we are seeing at the home, and what they're seeing at home. And this means talking through not just what it is that they need to learn, but also getting a baseline understanding of how it is that the parents may have learned and how they can contribute, and recognizing that some of them may know how to do the new math, but a lot of them won't. I will be one of those that says, yeah, I don't know how to do the new math, but I can tell you what stuff adds up to and detracts from, and I can give you the basics. That level of understanding is going to be important. Provide professional development for school agents of change. We're not just school teachers. We're not just leaders who have schools within the environment. Hold on, I don't know why this thing, you guys don't see the pop-ups on the bottom, do you? Okay, good. All right, then I won't get distracted by that. We're agents of change. We are here to support young people and families in engaging in remote learning effectively. The only way to do that is really to create critical environments where remote learning can happen, curriculum development through supportive resources, through telehealth, teledoc, through online barrier removal systems so that they can find this information easily and access it easily, and also have a baseline understanding that part of what it is that we will need to do is provide technology and technology resources. So either Wi-Fi based laptops or tablets, and have that go on and be persistent. This is a new normal now, and this is what we need to understand. We also need to extend time for BIPOC young people and target our resources for young people. So offering engaging summer enrichment programming that embeds the learning that will sort of help bridge the gap between resources and information that may have been missed during the lost year. Provide additional instruction time with early starts or extended day learning options. And I know everybody loves school, right? You want an extra hour or so in the day, right? Everybody's going to love that. But actually, young people might, if it's couched in the right way, if it's considerate, if it's thoughtful and thought-provoking. And I think there's a way to do it. Commit to a high-quality tutoring program for BIPOC young people tied directly to curriculum and instruction. These are ways that we're going to be able to expand and extend learning for young people. Through targeting resources for BIPOC young people, distribute resources equitably across school districts. Here's the elephant in the room. Here's what everybody knows. Not all schools are equal, but they should be. They need to be. Have a fair and equity baseline that all schools share resources within quadrants rather than districts, and that everybody funnels into that rather than by city rather than by zip code, so that each budget pulls from what it needs in order to be able to provide young people. So say this one school can only provide 100 and this other school can provide 1,000. That means that you have $1,100 for all of those young people, because that would be more equitable and fair and a better approach to learning and understanding. Engage community-based organizations with proven track records for serving young people, BIPOC young people and communities in need, to develop and identify and deploy resources. This is important. The reason that this is important and all of these things sort of tie in together is because you will then create real sustainable change for economic environments and impact environments for all of the young people needing services, especially BIPOC young people, but also their peers that would be not only impacted, but also, I guess, sidelined by their peers not having that access to that resource. So we've all been in a classroom, right, where you have this one person who knows a lot and this other person who doesn't know a lot, and you pair them together. The same idea works here with regard to resources. Everybody gets ahead in the end when everybody has the same understanding and knows. Address BIPOC youth academic, social, and emotional needs. Evaluate the academic achievement and growth regularly using valid, reliable, and comparable assets to identify unfinished learning and the need for acceleration. Ensure multiple data points are used to ensure that we are helping to tell the whole story rather than providing rationale for underinvestment in communities. Normalize celebrating BIPOC young people communities and recognizing diversity and investing in youth, seeing themselves reflected in the curriculum. Replicate best practices across programs and districts, especially where BIPOC young people are experiencing great gains through systems of support and access to resources. Screen regularly and often for physical and mental health needs using industry-based tools like CRAFT, HEADS, PHQ-9, and ACE, all of which are used here at the door. to ensure that young people are supported with early interventions towards healthy environments and healthy outcomes. Train every person on your staff on how to identify and address and support from a trauma lens, to support stress understanding, to support anxiety reduction, to effectively in a way that helps contextualize holistic approach with no downtime, meaning that they will always be engaging and connecting and supporting. Every conversation is an opportunity for intervention. Every intervention is an opportunity for change. Support full family and person, individual-centered approach in your counseling work. Continue to expand and provide meals programs with a lens towards farm-to-table healthy options or healthy alternatives to education to reduce healthcare impacts that happen around food. Create a pipeline to qualify for higher paying employment through career pathways. Link to local community colleges, providing contextualized certificate programs and training programs with a clear path to employment and an option for advanced degree attainment as a scaffolded approach to retention. Create scaffolds that approach employment placement and retention to ensure that BIPOC young people are connected to services and working, but then they're also accessing additional training opportunities that build their opportunities, that build their resume and opportunities for expansion or expanded learning. Create a network of a networking group for young people. I know this is one of those things where you're like, oh, networking, young people doesn't seem to go together, but actually it does if done the right way, because that's considered youth leadership. Generate wealth building opportunities through sustained financial planning systems that provide co-payment opportunities for young people to create savings towards value-added options and long-term goals. Connect with local banks or financial industries and resources to help create a lesson plan that is embedded in the framework of learning throughout the BIPOC young person's entire span of services. Build an infrastructure that incentivizes goal attainment with potentially the caveat of savings as an incentive. Create a college persistent pathway that is supported with throughout the entirety of their college career. So a lot of young people will be supported for their first year, but then after their first year, when they still need supports, when they still need someone to tell them, keep going, you've got it, you are doing this, help with removing barriers, that is a continuing, ongoing, and persistent need. And that's something that we need to recognize as a community of understanding that needs to happen in support of young people, especially BIPOC young people. BIPOC young people should be more inclined to remain engaged in school if there was support beyond that first year or the first 2 semesters. I think that BIPOC young people would benefit from ongoing access to mental health care and reducing supports, barrier reducing supports during their college career and beyond. I think BIPOC youth experience would be enhanced by the opportunity to earn while learning and create, if possible, a link between them and their junior and senior year equivalents to test into college-bearing coursework while they're in high school systems, while they're in HSC systems or GED systems, whatever we're calling it today. And when ready, the ability to reduce the amount of time needed for additional support and the time needed towards their 2 or 4 year degree attainment, a layering of services, if you will. So what are our approach and best practices at the door? So our approach is, the door's mission is to empower young people to reach their potential by providing comprehensive youth development services in a diverse and caring environment. And those aren't just words on a page. That is the idea. That is the mentality that we have around how it is that we're approaching this work. Let me move y'all over. Ooh, let me move y'all over and move back. All right. So we have embedded youth development principles. We have person-centered, person-first approach. We have trauma-informed care that we provide. We have holistic and focused mental health services in all areas. So within even the career and education team, we have several MSWs that are there at the ready to provide mental health services and referrals for mental health services. And that's important. We have a strength-based approach model, and we have a social justice lens that we operate from as an entire organization. These aren't just things that we sort of say in meetings. These are ways and mandates that we live by as an organization, and the way that we approach this work with young people. How we have addressed COVID as an agency. We created a food pantry to address food insecurity from an individual and whole family lens. We serve to-go meals that people did not have or did have access to kitchen or needed hot food were able to get access to. We provided telehealth and teledoc appointments to contribute to a continuum of care. We assisted virtually with membership to ease the burden of access to services. So a person who would normally have to come into our door to get services was able to do it virtually. And virtually for most of these services. Provided technology resources, as Michaela was talking about earlier. We provided technology resources like Chromebook and Wi-Fi to young people to persist in education and employment outcomes. We created virtual employment fairs to connect young people to job opportunities. And we provided virtual internships to ensure that young people persisted in opportunities to go from digital native, which is phone-based, to digital literate, which is computer-based. Some of the services that we offer daily at the door: college advisement, tutoring, counseling, creative arts, food and nutrition services, foster care, high school equivalency GED, employment internship, on-site vaccination, COVID testing, adolescent health care, leadership development, advocacy, legal and immigration services, recreation, wellness, supportive housing, runaway homeless youth services, and peer learning networks are all part of the system of an environment that really frames itself in youth development and youth-focused work. And one of the things I'm most proud of when working at the door and talking about some of these best practices and some of these things that we have done and that we continue to be committed towards are that we continue to ask the question, what's next? And we continue to ask young people, what do you need from us? And so what I'll ask you all within this last, I think it's last 15 minutes or less, is what do you need from me? What have I not covered? Or what questions do you have? Or what insights do you have that you would like to share with everyone? And I'll stop sharing my screen so that everybody can talk, I think, because that is my Q&A. Hey, look at that slide, huh? She's fancy.
Sure, this is Nell. I was wondering, do you have case managers, or how do you provide that kind of wraparound service to your folks? I'm more familiar with full-on adult ed programs, and we use case managers, I think, to do this, but I was wondering what you guys do.
Yeah, absolutely. No problem. So we have levels and layers of case management that happen. So there is our MSW core of staff that provide the mental health resources and counseling services, or referrals for mental health resources and counseling services. But then we have our staff that are either coaches, is what we call them within my department, or case managers, or activity specialists that are there to provide one-on-one tactical support to young people in an environment of considerate learning, but also awareness, and an environment where we are constantly sort of thinking in terms of how to connect people along the continuum. So if someone is sitting with a young person, they say, yeah, I haven't seen a doctor in a while. Oh, did you know we have an adolescent health center downstairs? Let me walk you. And then there's a soft handoff because they are introduced by someone that they trust to someone that they can learn to trust, because that person that they trusted introduced them. And so that's a different approach. And that's the approach that we have across the board for all of our our work. And so, yeah.
And is that all funded through one big, I mean, is that funding that you get from the city, or is that just you figured out how to cobble together funding to support that?
Well, our agency is funded by government and private dollars. So based on where it is that you're sort of getting your access to services from, the portfolios can look very different. For us, I'd say about 60 to 70% of our funding is government funding, and then about 30 to 40% is from private dollars, but all of it sort of cobbles together. I like that word, cobbles together to create this environment where we are constantly thinking about how it is that we can build sustainable systems and how it is that we can address needs, but also contribute to larger conversations that are happening around this work.
I really like that you said that you listen to students, you get their feedback on their needs. How do you go about doing that? Is it like in a one-on-one session with staff? Is there an actual survey? How do you get a read on them?
Well, there are different ways that we've tried as approaches. So we have had focus groups in the past. We have had evaluations that young people have done on different programs. We have had one-on-ones with young people, typically is I'd say 90% of the time, or at least 80%, the other 20% being what I'm describing. And then there's also this suggestion boxes that people put on different floors and in different spaces where they take suggestions from young people in case someone doesn't want to say something outright, because it's easier to give information or feedback in an environment where you feel safe. And sometimes young people feel safe just writing it down. And also we have a huge following on Facebook and on Instagram and TikTok. And so sometimes we get feedback and information from that. And then I'd say the other piece of this is that we are constantly thinking in terms of how it is that we can really incorporate young people and youth voice into this organization. And so we have youth services that are specifically towards leadership. One of those being the Youth Council, where they gather together and they represent the youth body. We have youth that are participating on some of our board systems at the top level to make sure that we are being holistic in our environment about how it is that we're approaching our work, and having them speak directly to the board is important because it keeps us accountable and honest about our work and how we're framing things. We also have wellness ambassadors that provide direct services as young people to young people. And we have peer-to-peer organization systems where we have peer health educators and peer educators that provide services and that get direct feedback, and then they fall into the loop. And I think one of the critical areas that we also have young people have youth voice, and it's youth-led, is that when we interview for different positions, especially if the young person is going to be directly impacted by that position, they have to interview as well. Their voice matters just as much as ours, because if the young people will tell you things in an interview for someone who's a teacher that you won't notice, but they'll be like, she seemed nervous, or he didn't know what he was talking about, or, it's just a good different sort of lens to have at the table for all of these different points. And so, yeah.
I have one last question, and that is, you've described an amazing amount of services that your program does. And I'm kind of jealous. You have a lot of wraparound services. You were able to get Chromebooks to all your students during a very difficult time. When you're talking about needs for BIPOC youth, were you talking about across the state? And do you feel your program is kind of like a guiding light?
I absolutely do. I think I'm not just going to keep it insulated, and why I tried to keep it as general and broad as possible is because it is a state represented organization. And I want someone in Albany to feel that this is as accessible as someone in Brooklyn. And I want this information to be as transitory, and these things that we're doing as transitory in all of the different environments that it might find itself in. And so, you know, I'm more than happy to do micro insular sort of research and data specific and germane to New York City. But the things that I've talked about are actually national things that are happening on the forefront, and not just things that are happening here in New York City. Because it's that huge. The need for interventions is that huge. The call to arms that people should feel whenever they look at this is that huge.
I just want to state something too. If anybody else has a question, they can speak up or put it in the chat, but we do only have 3 minutes left. And I do just want to remind everyone to please fill out the survey after 4:45. It should generate in your Zoom event, and the recording should be active, I think, within an hour. So thank you so much, Rashard, for sharing all this with us. You brought a lot of information to the table today. Thank you.
Thank you. Thank you so much. Thank you. That's my boss. Thank you. Thank you. Thank you, Ross. And thank you so much to all of my staff that came in support. I am so happy to have had this opportunity to present you guys with this information. And like I said, I didn't think I would get picked. I'm so happy to be picked and just, you know, honored to be selected because I was like, that sounds like a really boring topic, but it gets me jazzed to talk about economic impact on environments, and specifically with the lens of how it's impacting communities in need. And so I'm here all day for it.
We were lucky to have you. Thank you so much. I hope everyone enjoys this afternoon too. It's weirdly warm. Enjoy it if you can.
Yeah, yeah.
Bye.
Bye. Thank you, everybody.
Great
Thank you,
job.
Rashard.
Thank you.